corrections for the past 14 years. I've been a corrections nurse. Men, women, had the juveniles, had the mentally ill, had the pregnant ladies, had death row. Yeah. Guess what I'm trying to do for y'all? Try to get clinicals in the prisons.
That would
You guys
actually
can
be really
experience
cool.
it.
That would be interesting.
Oh, we just got chatter.
I've wanted it for a long time.
Hey, Kira's a graduate of Marion Tech.
Yeah.
Yes, I graduated from Marion Tech years ago. So it can happen. It's very, very stressful going through. When I went through school, I had a little boy. He was 4 years old. I also worked, and we didn't have all the resources that you guys had. Where's my note card lady? That's how I got through school, is little index cards, writing everything down. Okay? So all the stuff that you have, it's a benefit for you. So we'll talk about stress. Let's talk about what you guys already said. What do we know about stress? What do we just heard a little bit about? Say it loud for everybody. I know she talks louder than that.
Stress is a killer.
You have kids? You talk louder than that. Stress is a killer. Who's affected by stress? Everybody? Just the person that is dealing with the thing? No? What happens? Does it kind of ripple out? All right. So I'm going to give you a little scenario. Lacey. The only reason why I'm picking on Lacey is that she's the only one I know her name. Other than Susan. And you're going to understand. This is serendipitous. But Lacey was working on a project or studying with Susan, and she got a bad grade. She went home, talked to her dad. Her dad's a captain at the same place where Susan works. Her dad retained Susan. She ain't in class now. Yeah, Susan works third shift. She had to work a double. She went home, got into a car accident on the way home. She can't come to class. We'll say she's got a broken clavicle. We'll say she messed up her face a little bit and stuff like that, okay? Who's feeling the stress? Who's stressed? Susan?
Yeah.
She's hurt, right? Lacey found out about it. She feel bad?
Yeah.
She feeling stress? Yeah? How about y'all was working with Susan on a project. Susan can't be here, so now y'all gotta take up her slack.
Yeah.
You feeling stress?
Yes.
Take a stress. Oh snap, I just became the favorite instructor guest speaker, didn't I? Okay, taking a stress. You're kind of quick, you gotta get there. Oh, now you're talking.
It's just what you wanted.
What happened next? Lacey has to talk to all of her friends about what she done did. Now they're feeling guilty. Y'all are friends. But she was picking on everybody, right? Y'all are friends too. You have to. You can trust somebody else. You gotta take one right now. I try to make sure there's enough of it. Right. All right.
You want me to pass them out while you see them go on?
If you want to.
I'll do it. Then I might have a little favor.
You won't have stress.
Pretty stressed.
All right. So then we've got Susan's coworkers. Susan can't be at work now. That's about 20 of y'all. Because you got to pick up the slack for Susan. She can't work third shift now, so a bunch of you guys are getting retained. Susan, by the way, is a correction officer at Marion Correctional Institution. Typically, she works roaming the halls and stuff like that on third shift. After that, the media gets light of some of this because Susan's telling her story to the officers that come to the scene, and they say, well, what happened? Well, she says, I'm all tired and stuff like that because I had to work and I got retained by, one of my students' dads, and she did it because I don't know. She don't like me, something like that. Okay? So now the school gets involved. They come and contact the school. Why? Is there an anti-bullying policy at most schools these days? Yeah? Okay? So now, the school gets investigated. There's maybe some changes that happen in the school, different things that have to occur that you guys have to deal with now. Kathy and Cindy and Angie, they gotta go through and they gotta do all kinds of new stuff. She's almost done. What happened? Do all of you guys have a piece of stress now? The purpose of me saying this and doing this is when you go in and you're treating your patient, it's not just your patient. It's not just your patient that is dealing with this. You guys being students, you're not the only one feeling the stress. How many of you guys have kids? Okay. How many of you guys live at home with your parents? How many of you guys have spouses? Or boyfriends, significant others, anything? Special friend. When you get stressed out, or when they get stressed out and they come home, who do they yell at? You. You? When you got a bad grade on the test, you go home, and your kids are like, Mommy, 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 or Daddy, 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 Daddy. I don't know if you guys have anything yet, any kids yet, but what are you gonna do? Do you have the patience that you had before? No, you don't. You're gonna snap at them, right?
Yeah.
Okay. What happens to your patient that is elderly, that came in, that maybe has a little touch of dementia, and they're in there because they tripped over something trying to climb over the neighbor's fence thinking they live there. It happens. So now they come to find out you have to treat that patient, but that family's got to find a better place for that patient to live, or somebody has to live with them. Okay? All right. So let's look at stress. What is the definition of stress? Anybody? Straight out your book. I did the reading too. Definition of stress. It is a condition in which the human system responds to changes in its normal balanced state. What's that mean? That means we're chill? We're good? No. It means something happened. You have an exam tomorrow. Oh. Oh. How does it work? How does stress work? Does it affect the entire person? Physical state, psychological, intellectual, social, spiritual? Yes. So what do we as nurses do all the time? What is going to be drilled in your head for the next few months? Holistic care, yeah? Mind, body, spirit. We take care of everything. Why? What's this over here? Maslow's hierarchy. Does some of this stuff have mind, body, and spirit in it? Yeah. Wonder why? Because we take care of the whole person, not just the illness. Okay, so what are different physiological reasons that would cause us stress? Give me an example. What might cause you stress? Physiologic. What's physiologic mean? Physical?
Menstruate.
Okay. When women go through it and they're having their cycles, teenage girls, thank God I don't have teenage girls, they get on birth control at the age of 2. Yep. See? Now you know why she's stressed. Okay? Yes, menstruation. How about maybe some chemical issues that go on? Yeah, we're gonna talk about that when you guys get into the different things with mental health. Or how about the heat and the cold? How many of you guys like the summer versus the dead of winter? Yeah. Yeah. How many of you guys drive in the wintertime and stuff like that, and you're out in the rural area, and you're like, oh, just let me get there, let me get there, let me get there, let me get there. Uh-huh. That's a stressor. All right. How about our psychosocial? What is that? You guys gotta talk or I'll pick on you. I ain't scared. I come from corrections. Come on, give me something. Psychosocial, what happens? What is that? Relationships? A birth? A death that might occur? What happens with that? Do you get happy? Do you get sad? Do you get nervous? Some of you girls, if you took a pregnancy test right now, you found out you were pregnant, what would go through your head? Oh, I done messed up. I am the Virgin Mary to begin with, so woo. So your environment too. What did COVID do to everybody? What did COVID do to the nation? They got stressed out. And guess what? I found out why we had a shortage of toilet paper. Everybody got stressed out and had diarrhea. That's what happened. All right. So how do we deal with this? And what are the different ways that we can adapt through this? What is adaptation? It's how we deal with the stressors, right? How do you guys deal with getting ready for an exam? How do you deal with going through a breakup with a significant other, or a divorce, or a marriage, or an in-law? What happens when the mother-in-law dies? I'm so sorry, honey. Right? Uh-huh. Yep. I'd be saying that too. Just saying. All right. Coping. How is it that we cope? Can our body do this already? Does our body already handle stress and emotions without us even knowing? Does it? How? There's different systems that you guys are going to go through, and you're going to know all of this by the time you're done with everything. And it's a lot. Your nervous system. What does your nervous system do? We already talked about this, talking loud.
You get nervous, your body starts to sweat, which cools you down.
Okay, your body starts to sweat, so it'll cool you down a little bit. What else happens? Maybe get a little shake to you? Yeah? So say again? Fight or flight, there you go. That's kind of where we're going with it. How about your endocrine system? Does that play any part in it? Are there some hormones that are going to happen? Yes, you'll learn about that too. Cardiovascular. When you're getting stressed out and nervous about something, what happens to your heart rate? Increase? Yeah. And if you are dealing with stuff well, what will happen to that heart rate after the initial stressor happens? What? It'll come back down to normal, right? And we'll say why here in a minute. Your renal and your respiratory rate and your gastrointestinal. I already said gastrointestinal. What's it doing? It's pooping. All right. So homeostasis. What is homeostasis? It's keeping a balance. This is that balancing act. So if you have a stressor that happens, are you able to bring yourself back down? This is both physiologic and psychologic. So if you have an injury that happens, we can heal from that. Or if you have physical issues, then we can help that. If it's emotional, how do you go and how do you come back with it? There are different ways that we do, there are different categories that we can put this in. LAS, the local adaptation syndrome. The way I remembered this, I can remember this, is I think of a lasso. I'm a cowgirl too. When I go and I want to lasso something, I'm aiming for a specific area of the body, which depending on what it is that you're roping, it can be the feet of a cow or it can be the horns, yeah? So for LAS, the local, it is just one area. This could be tissue or an organ. With that, we're looking at reflex pain response. So this is where if you touch something hot and you're gonna pull it away, yeah? Or if you have a pain somewhere, it's gonna come back. There's also the inflammatory response. What did we learn about that? When Kathy showed us her wound, what did we learn about that? Was she swollen everywhere? She was swollen to that one area, right? Okay. General adaptation syndrome, gas. If you have somebody that goes and crop dusts you, does it go just to the one area or is it kind of everywhere? Because you can smell it for a while, yeah? Everybody knows what crop dusting is, right? It's not when the plane comes and goes over the crops. It's, yeah. Gas is passed. Okay, so this is something to where the entire body has a response to the stress. And it comes in different stages, yeah? The very first stage is the alarm reaction. What happens when something, you just about hit a deer when you're driving? What happens?
Freak out.
You freak out, but what happens?
Slam on the brakes.
You slam on the brakes. Huh? You get tense. You're like, oh snap. What else happens? Your heart rate goes up. What else would go up? Your respirations. What else? Your blood pressure. Absolutely. What's going to happen to your pupils? They're going to dilate. If you want to see this, I like doing this, and please, I'm not mean to my cats, but if you have cats and they're looking you in the eye and you can see their pupils, hiss at them just a little bit. Watch their pupils dilate. This is them going through that alarm reaction, and you'll be able to see them dilate, and then you'll be able to shrink them. They'll shrink back down because they've coped, and they're coming to a homeostasis. Okay. Excellent way that I do it.
I used to do that with my beta fish, because if a beta fish male sees itself. So I put a mirror in the tank.
Anybody with your big get off,
So when we talked about the fight or flight, and you're about to hit a deer, what happens to your level of alertness? It goes up. You know what's up. What happens if, and nobody do this because it's a very bad thing, what happens if you maybe had a few drinks and you're driving home, you probably shouldn't be driving home, and you see police lights?
Oh, God.
Oh, I'm alert now, right? Okay, that's that response that kicks in and happens. The second stage that we go into, this is the resistance stage. This is, okay, I almost hit a deer, I didn't hit the deer, nothing happened, and you come back down, right? What happens to your heart rate? It comes back down. What happens to your respirations?
Goes back down.
It comes back down. What happens when you stop hissing at your cat, and what happens to their pupils? They come back down. Absolutely. Your body comes back to a normal state. So, after that, we go into our stage of exhaustion. What happens here? What is the stage of exhaustion? It's in the word.
Tired.
You're exhausted. You can't cope anymore. It doesn't happen anymore. So what happens? Your body says, I'm either gonna rest so that I can recope, or you're gonna die. Yeah, one or the other. Woohoo. Hey, body. All right. So let's let's look more at the homeostasis and stuff like that. So, psychological balance, we already talked about this a little bit. What is that? Psychological is what? How we feel, our emotions, stuff like that. Physiologic is what? Physiologic is what?
It's all mumbo jumbo.
Mumbo jumbo. Physiologic, you have some clinical manifestation out there, okay? So physiologic, physical. Your body's response. Your psychologic, your emotional state. So when you guys sit down for, here's my story. You guys are gonna sit down for your NCLEX exam to become a nurse. You've got, at that point, 75 questions is a minimum that you have to take. The questions are supposed to get progressively more difficult, until the computer says, okay, you know what you're doing, and after 75 questions, it'll shut off. Or, it's gonna say, after 75 questions, dude, you're stupid, and it's gonna shut off, and you're not gonna pass. Or, it can continue on, and you can take more questions, it depends. My story, nursing student, sit down, take my NCLEX. Go through, take all the questions, it's question 75. Here's my question. You have a client that is taking insulin. What is a side effect of insulin? A, it was hypertension. B, hyperkalemia. What is that? Okay. C, thrombocytopenia. You guys know that one yet?
Blood clot.
Okay. D, low blood sugar. That's like, really? Really? This is my final question? So I answer that question, the computer shuts off. I'm bawling. The computer says I'm stupid. I didn't pass. That was my final question. I'm an idiot. I'm gonna have to go back through. I'm gonna have to take the test again. I'm dumb. I'm this, I'm that. What kind of a response, what kind of a stressor was that? Physiologic?
No.
Or psychologic, yeah? So guess what happened? I passed the test. I'm a nurse. Woohoo, woohoo. What happened to my state of mind after I finally logged on every 5 minutes until it finally had my RN number on there? Yeah, because I thought I failed, then it finally showed up and I was able to come back to normal. I was exhausted, but I was able to come back to normal. You're gonna go through that too. Do you guys go through that now when you take your exams? Yeah. How many of you guys refreshes the grades? Yeah, I do that now too in my master's class. I go up there and I refresh the grades. I've gotten her pattern as to when she posts them now, so I don't have to do it throughout the night. And that's Arizona time too, so.
Supposed to be sleeping.
Well,
Yeah.
it's
No one
Arizona
does it
time.
now.
Yeah. All right. So, what are the effects? Did I already pass by? I passed by a lot of that, didn't I? No, yeah. So, the actual effects of the body. So we talked about the emotional balance and all of that kind of stuff. What happens if you don't come back to it to have a good state? No, I did pass. How do you go back, hon? There we go. All right. So our mind and our body, conscious and unconscious. When you're feeling stressed out and stuff, what things can happen to you? Usually, we already talked about, or dilated pupils. Do you have dry mouth? How many of you guys have gone to an interview and you're sitting there and you're yeah, you get dry mouth. It happens. Did you tell your body to do that? No, it just did it. Sometimes some people can get awful nauseous. Some people can gain weight. Some people can lose weight. How many of you ladies, if you've gone through any kind of a breakup or anything like that, you've lost weight? Y'all can go ahead and walk out the room because I hate it. Okay. All right. Anxiety. What do we know about anxiety? It sucks. When you sign up for nursing school, it's just like, here's your diagnosis, right?
Yeah.
Okay. It is common. It's one of the most common forms of stress that we do see. How people can deal with the anxiety is through different coping mechanisms. There's different categories of anxiety. You can have mild anxiety. What is this? We're a little restless, maybe you ask questions. How many of you guys have toddlers that ask you 50 million flipping questions? Yeah. Or like you go someplace new and or have a surprise. Well, where are we going? When are we gonna get there? What am I gonna do? What kind of foods are gonna be? Chill. We'll get there. How about moderate? Moderate, this is where our perception, we're getting a little bit more narrowed, our heart rate is gonna go up a little bit more. Can we teach during this stage? The first two stages? Can you talk to your patients and try and give them some teaching? Yeah, do you think it's going to stick around a little bit? Okay. How about if we get into a severe stage? Impaired learning. They're not going to be able to handle a whole lot of stuff. They're the ones that are sitting here doing stuff like this, maybe a little bit, and then you have a full-blown panic attack. How many of you guys have seen a full-blown panic attack? A few of you? Okay, when you go in some places, even emergency rooms and stuff like that, you got people that are coming in, a 22-year-old is coming in saying that they've got chest pain and they're having a heart attack. Okay, their EKG and everything is normal. It's probably not. They're probably experiencing a panic attack. They are not in connect. They cannot connect with what is actually going on around them right now. You have no flipping clue what's up, what's down, what's anything else. Are you able to console somebody in this state? No. Are they safe in this state? No. Are you gonna teach them? So now we're gonna do some relax breathing and we're gonna talk about our wound care. Not gonna happen. Not now. The ways that we are going to cope. How is it that you cope? We talked about this a little bit too. What do you do to de-stress? Huh? Exercise? Some of you guys might already be doing some of that. Anybody get into eat your stressor yet? Come on.
Yeah.
Nobody ate your stressor yet? I would have already eaten the stressor. Eating. Some people will eat. Some people drink. If they have too much anxiety, too much stress, do some people use some illicit drugs? Yeah? So we have good ways to do it, good ways of coping and bad ways of coping. Coping skills are something that you learn too. What did your mom and dad do? What do your parents do? What did they do to cope? Were they an alcoholic and that's how they coped? Were they abusive? And maybe all of their stressors they took out on somebody else? Those are all ways of doing it. And those are different defenses that we can do. How many times have you guys had, or have you experienced anybody that has been in an abusive relationship and they said, oh, but he loves me. She loves me. They won't do it again. Okay? Or what if you have a person that has a patient, they have a history of breast cancer in the family. Everybody's got it. And when you guys go in and you do a breast exam or something, you notice a lump. Oh, it's fine, it'll be fine. I don't need to get it checked out. It's not a big deal. Really? With this big history? That's them coping with the use of denial. There's a big list of this in your guys' book. How about, we already talked about it, the displacement. You guys did really, really poor on your exam. You go home and your kids are wanting attention and you holler at them. They didn't do anything. You're transferring all of that over to them. All right. In the very beginning, I said all of this comes back to Maslow's hierarchy, right? When we go through and you are stressed out, we have a scale that is out here. On one side, we're healthy, and we're in a homeostatic state. On the complete opposite end, you're exhausted, and you're gonna die. Kind of drastic, yeah? I'm alive and well and happy. I'm about to go 6 foot under, or get all burned up in ashes. By the way, I want to be cremated so that y'all can choke on my ashes when I'm gone. Just saying. So, can stress cause an illness? Can it cause an illness? Or can it make an illness worse? Yeah? If you're totally stressed out, if you have a patient that has psoriasis, do you know what psoriasis is? It's a skin condition. Okay, and if a person is stressed out, does that skin condition get better or worse? Worse. Why? What happens if a person is stressed out? What happens to their immune system? It'll probably go down, yeah? Because they're using all of their energy to deal with this known or unknown threat. So what are the long-term effects on the body? What if you have a patient that is dealing with diabetes? New patient with diabetes. They don't get to have all of the nice stressors that you guys just ate or are gonna eat or give to your kids or whatever you're gonna do with it. They have to check their feet all the time. They don't get to wear nice pretty sandals. Nobody likes their feet because they usually have ugly toenails. They have to check their blood sugar all the time so their fingers or anything else on them where they're gonna stab themselves hurts all the time. And guess what? It's expensive. So that goes over to family members and stuff like that. If you have a young child that just got diagnosed with type 1 diabetes and they have to go through all of this kind of stuff, is that child gonna go through and have a sense of self like any other kids in their class? No. So what's gonna be affected on the hierarchy? Their self-esteem. After a long period of time of dealing with that, what do you think is gonna happen to that little boy or little girl later in life? Do you think maybe they're gonna have to deal with some mental health issues? And maybe down the road even there's gonna be some suicidal ideation? Good. The whole point of this class is learning how it is that you can take these stressors and handle it when it's small before you allow it to get so big. And talking about patients, our patients and stuff that we're gonna be dealing with, try me. Every single one of my patients, 2,400 of them are incarcerated. What kind of stress are they gonna have? Who are they gonna project that out on? I just told this guy, hey, you have HIV. This is what happens when you share needles. This is what you're gonna have to do for the rest of your life now to protect yourself, to protect your kids. What happens if there's a crisis that happened? What happens if we go through and let's say there's a gas leak here in the school and half the class is getting sick and carrying on and stuff like that. What's the rest of the half of the class thinking? Deuces. Where are you gonna save your fellow person, okay? What happens when the World Trade Center fell? What do we all feel then, 9/11? What'd you guys feel? Anybody? Do you guys even know about it? I feel old! Alright, so you guys are young. That was a wrong example. Alright, so let's talk about yourself then. How is it that you're gonna get through? How is it that if you have something happen to you? What happens when you go into clinicals and you go and you're about to do a new skill? You're so excited, you're ready to do it. And your instructor goes, and you go out in the hall and she's like, he or she, I think we all have all female. That should be fixed too, but they stop you. No, we're gonna redo this all over again. What's your stress level gonna be like now when you walk into the room and you thought you had it? I'm gonna insert this IV, I got it, I got this, I got that. Is it stressful? Is it high anxiety for you? If you're about to start an IV and your instructor says, let's try again. Yeah, that sucks. You go home and you're thinking, what did I do? This is terrible. All right. So here's your question. First question. So we see how I did. So, nurse teaches problem solving to a college student is in crisis situation. What statement best illustrates the student's understanding of the process? What do you guys got? What do we think? A? Okay. Why would it be A? Because they're identifying what's wrong.
Problem, you're just gonna keep spiraling.
There you go. Yep. All right. I'm not going to use this slide. I'm going to actually switch it over to some of mine. Maybe.
Probably have to do it twice.
Yep. Okay. All right. So this is one of my slides. Take a picture of this if you guys want to, because you're going to use it later on. This is how stress affects the body in the different areas. It's a pretty good one. We already talked a little bit about, or the TED Talk talked a little bit about, your sexuality and stuff like that. But with the neck, we're gonna have some sore throats, some mouth ulcers as well. We already talked about high blood pressure. What comes with high blood pressure? We're at risk for stroke. So if you got a guy with a blood pressure of 215 over 120, is that good, bad, or indifferent? What is it? That's bad. That's bad. All right. So, our stress hormones. We already talked about this and how it works and what it does, but this is a different slide that I had that I created for another thing as well. So the different ways that our stress hormones are going to react to help our body come back to that homeostatic state. All right, so how is it that we are going to go to have a healthy lifestyle? What can you do for yourself to center yourself when you're in the middle and dealing with stress? Give me some, or I'll give you guys some.
Self-care.
Self-care, like what?
Simple things like taking a bath, just taking care of yourself, relaxing.
Taking a
Doing
bath.
something you enjoy.
Lighting a candle. Will that bring you down a little bit some too?
Yeah.
Depending, unless it's a nasty candle. It might aggravate you a little bit more. If you're a parent, how amazing is it to have a break from the kids and maybe go to the grocery store and just cruise? Is that a de-stressor or what? For me, that's a de-stressor. Is alcohol?
Yeah.
Is alcohol a good thing? Heck yeah, margarita.
Yeah.
In moderation. In moderation. What about if you just want to chill out? Smoking a little bit of marijuana, a good thing, a bad thing? Dude, I'm calm and collected if I did that. Honestly though, okay, so working in corrections, that's where I learned all about drugs, okay? So as the reception nurse, when I first started there, I knew nothing about drugs. And part of the question that we have to ask is their drug history. So we got to marijuana and I'm like, well, did you smoke it, snort it, inject it? And this lady looked at me and she said, what is wrong with you? What is wrong? You don't snort it, you don't inject it. What is wrong? You eat it, you smoke it. Like, well, how do you eat it? Yeah, So, if you guys wanna learn a little bit about that, I got some stories. And Susan will tell you some stories too, whenever she decides to come back to class after Lacey stops bothering her. Any of you guys into pets? We already talked about the cats, dogs. Okay? Pet therapy is a real thing. Why do you think they bring the dogs in the hospital sometimes? Miniature ponies too, by the way. Miniature ponies are on the list now as a support animal. Okay? Dragons, bearded dragons. So in corrections at Marion, I started a reptile program there, and they bred and handled bearded dragons. Why? It's a pet, it's therapeutic. They have to take care of something else. So it's not just them, it's something else. So, I'm almost done. So how do we manage stress? How are you gonna do it as a student? Don't just read them. How are you gonna do it as a student? You're gonna go to sleep. Good job. That she got brown nose points. Eat well. What else? Staying organized. Organized is a really good way so that you don't overwhelm yourself. What did you say? Setting boundaries, absolutely. When you get put onto a group, how many times have you guys been in a group and there's 2 people working out of the 14 in your group? And then you got one person that presents because everybody else is like, yeah, thanks. That happens, okay? Avoiding the hot topic, the hot topic buttons. So do we talk about politics? Do we talk about religion? Do we talk about how nasty our significant other's hair is in the morning and how bad their breath is and all of that kind of stuff? No. No. Compromise is a big thing. So when you guys are out there in the world, you're gonna learn that personalities clash. Do all of you guys get along with everybody in the room right now? No. Some of y'all are like, ooh, if I saw you on the street, I'd walk by and look the other way, right? Do you have to work together?
Yeah.
Yes? Are you gonna have to work together out in the community and stuff like that when you become a nurse? Yes, you have to work with your fellow nurses. Are you gonna get along with the physician? You better. You better. Are you gonna make a phone call to the physician at 3 o'clock in the morning because you have to get clarification on what a patient is doing? And they're gonna say, what? Are you stupid? Why are you calling me for this? Or, you're not prepared. Call me when you actually got your stuff together, and hang up on you. Do you have to still treat that physician with respect?
Yeah.
And will you still have to work together with him afterwards?
Mm-hmm.
And what do you learn from that situation? I ain't never gonna call you again. You can just deal with the dead body in the morning. No. You're gonna learn that you have all of your information in front of you so that when they ask all of the questions, you got it there, okay?
But you should also talk to your manager because nobody should speak to that.
Yes. You're not meant to be abused either.
Documented.
Okay.
Not on the patient.
On the patient record. So, what about family members? Are family members going to be talking to you all kinds of crazy? Remember, I'm from corrections. I got family members that talk to me all kinds of crazy. Have family members follow me from home. Yeah, they followed me from the prison home. That was fun, especially during COVID. That was fun. How is it that you are going to go and deal with that kind of stuff? What happens when you're in the community? And guess what? There's somebody falls out in Walmart. You're a nurse. You happen to be in your scrubs. What are we supposed to do? You're going to help? Okay? You don't have anything. You have absolutely nothing with you. You give it mouth to mouth? Huh? You want to take that home? home and kiss your baby with it? No. Okay, so the whole point of this class, or this particular lesson is, stress is real. Stress is not just your patient. Stress is not just you. It has a ripple effect. It's gonna go out everywhere. Figure out what works for you to keep yourself balanced. Because right now is gonna be a low point for you versus when you're out there and it is a life or that you have a person's life in your hands. Okay? What are you gonna do if you did everything that you possibly could and that patient died? You go home with that, right? You're gonna have to find a way to deal with that. Because if you don't deal with that, it gets bigger as you go on. A lot of you guys are very, very young. And life's hard. Life's really, really hard. You have to learn how to center yourself at this young age. Some of you guys that are a little older and you haven't already learned this, learn it. Because you have to learn, where do you go? Where do you go for your comfort? Where do you go to come and center yourself? Is it spiritual? Is it okay for you to pray with your patient? Is it?
They're okay.
If they're okay with it. When you guys get into OB and stuff like that, you have a mom that just lost her baby. Yeah, how are you gonna deal with that? Some of us moms are like, oh. Or maybe when you get into peds, you guys don't get to deal with this. But when I went to peds, and my very first clinical rotation, I had a little girl that was sexually abused. And I got to call Children's Services, and the baby was taken away. And I was a mom. How do you take that home? How do you deal with that? There's a reason why I don't work in peds and why I work with the criminals that did all of that. Okay? Yeah. I'm strange. I know. It's okay. All right. So, how do we do it? We talked about a lot of these. You guys already come up with a lot of these. Try not to do any of the illegal stuff. It's not good for you. Don't bottle it up. That's not good for you either. Expressing yourself accordingly. If you are getting stressed out, if stuff's going on here, if you don't understand something, if you don't understand some of the course material, get clarification on it, because what's going to happen? It's going to get worse. Because if you don't understand the basic stuff of things and you don't ask, it gets worse. Okay? All right, now I got to flip back over. What do I hit? GTMI?
Yep.
Maybe.
There it is.
There it is. Okay. We have a few more questions and then we're about done. I do have an evaluation for you guys that you'll have to do. Sorry. All right. These nurses teaching a patient about relaxation technique. Which statement demonstrates the need for additional teaching? Learn how to read the questions, guys, too. It'll help you all a lot. What we got? Okay. How about I gotta breathe in and out in rhythm? Okay. Or I expect my muscles to feel less tense. That would be right. Yeah, take your pulse and I expect for it to be faster. If you are relaxing, what should your pulse do? Okay. All right, a nurse is caring for patients in the hospital setting using anticipatory guidance to prepare them for a painful procedure. What does that mean? I'm about to insert this IV in. You might feel a little pinch. Ready? 1, 2. Okay. Which nursing intervention is example of stress management? You heard B? When I say to focus on a pleasant place, mentally place themselves in and breathe slowly in and out. Okay, what's that have to do about pain? if it was B? It doesn't, right? You think it's what? A? What's that got to do about pain?
C.
C. Nurse teaches patient about the pain involved in the procedure and describes ways of coping with it. What did I do? We're gonna experience a little bit of pain, Ready? Here we go. 1, 2, 3. I talked about the pain and stuff too. All right. Now we get to have case study. Christopher is a nursing student. He's complaining that he feels sick. Actually, let's not use this case study. Let's use this case study. You're a student, and you were assigned to give a presentation to a moderate amount of people. You were given 1 week to prepare for it. What are you feeling? Anxiety? Stress?
Like I got 6 days to worry about that before I gotta deal with it.
Okay, procrastinator. What else? Overwhelmed? Did I get told what resources to use? What's my topic? Underprepared? Have you guys ever given any kind of a presentation in front of people? Yeah? In front of a good audience? Feeling a little nervous? Maybe your voice is gonna crack a little bit? Yeah? Okay. So guess what? That person was me. Last week, they came and told me that I'm gonna go ahead and deliver stress. Woohoo. So, I do have an evaluation. I am a student. You guys do have to tell me how I did. And then the faculty